Hi everyone. Well, we always knew that this time of year was going to be difficult for our new trust, and clearly things are definitely hotting up. Although we're much better placed now to deal with COVID-19, it doesn't really feel like this at the moment, as the numbers admitted are actually higher than they were in March. At the same time, our staff absence levels are higher. With such high rates of COVID-19 in the community, more people have been infected. And with more testing going on, both internally and externally, greater numbers are being asked to isolate. On top of all the emergency work, of course, our teams across the Trust are still doing everything possible to bring in those patients requiring planned care and treatment. No wonder it feels so busy. Do you know, the way our hospitals have responded to the recent surge has again made me so proud. Thank you to every single one of you for all that you're doing to support both our patients and each other. I'm so pleased that this week we'll be introducing asymptomatic testing for our staff. This is going to be so helpful. It's going to make such a difference within the Trust, helping us to reduce the spread of COVID. It's clear people can easily have the infection without showing any signs. So details as to how to access these tests will be coming out very shortly, if they haven't already done so. So do take part in this regular testing for the sake of your patients, your colleagues, and indeed your families. Obviously, lots of the headlines now are really encouraging, with so much good news being publicised about the COVID vaccines. Plans are well underway across Dorset so we can start providing this as early as possible in December. Whilst the majority of this will of course be carried out in primary care in the community, we will clearly have a role within the Trust in vaccinating our own staff, and of course we'll be supporting the wider mass vaccine effort. We don't expect this to present real problems. It'll be a bit different for us, but we've got to remember every year we've got a lot of experience in delivering the annual flu vaccine for our staff, and we'll be building on this going forwards. Now, speaking of the flu vaccine, can I encourage anyone who hasn't had their jab yet to get it done this week? You really need to act swiftly now for two reasons. Firstly, it's so important that you get the protection that's available to you for your patients and your family to protect you all from the flu. Secondly, with the imminent rollout of the COVID vaccine, this is doubly important. Staff will need to have a gap between the two vaccinations, and none of us wants to see any delay as we work to protect ourselves and each other from this awful virus. Now, all that's been going on over the past few months with COVID has really brought to the fore the enormous contribution made by our laboratory staff every day. They make such a difference in the delivery of safe, high-quality care. Now, I particularly want to focus on our microbiology teams, our molecular pathology departments, and those working within biochemistry. COVID has placed so much pressure on these teams. They really have never worked so hard in their lives, and I do want to pay tribute to them. I visited here again today to speak to staff and learn a bit more about how things are going, but most importantly to thank them for everything they've done to support us during the pandemic. Their work has been absolutely vital in helping us to diagnose patients and staff with COVID across the whole of Dorset. At the same time, they've been maintaining all the other tests that are needed to carry out business as usual. Vast numbers of Pillar 1 tests have been coming through our hospital laboratories, and on top of this, it seems like every week there's another new ask of the team. We should all be humbled by the commitment of our laboratory staff. They are all simply amazing. Thanks, guys, we really appreciate it. Now, it's clear to me, talking to staff today, that they are all a really good example of a team that's living out our UHD values, demonstrating that we're caring, that we're one team, that we listen to understand, that we're open and honest, that we're always improving, and that we're inclusive. I'm so pleased with all the work that's gone on across the Trust to develop these values. Do you know, they're not something that we've just plucked out of the air. These are the things that our staff have said that they hold dear, the things that enable them to do a great job, and the things that are going to make UHD a really great place to work. I'd also like to say an enormous thank you to all those who were involved, most importantly our culture champions. They've done so much listening and analysis over the past few months. Going forwards, we're going to be developing a new behavioural framework to support these values, and we'll be embedding them into our appraisal and recruitment processes. In this way, our values will be truly effective in shaping our culture, and this will affect the way that we behave towards our patients and each other for many years to come. Finally, with all that's going on, we must remember to look after ourselves and our colleagues. Across our sites, we've been working to make sure that there are enough designated areas for staff to enjoy their breaks. We've also been working to re-establish the safe spaces, the places that we know are so important to you in getting through these really challenging times. Our staff are quite genuinely our most important asset, so please take care and let us know if there's anything more that we can do to support you in the workplace. My final message today is to repeat how very proud I am of all of you for all that you're doing. I know that this winter is going to be really challenging, so let's be kind to one another, look out for one another, and know that we will get through this together. Thanks everyone, to each and every one of you, for all that you do. Take care.